Today, we're diving into the world of the Zika virus. But we're not just talking about the illness itself. Nope. We're going to crack the case on how it's actually diagnosed. Because with a sneaky virus like Zika, getting the right test at the right time is absolutely everything.
So picture this. You just got back from an amazing trip somewhere warm and tropical. But now you feel a little off. You've got this little fever, maybe a weird rash, and you probably think, it's just a virus. It'll pass, right? But what if it's something more? Something that leaves a footprint long after you feel better.
I mean, just look at this list. A low-grade fever, an itchy rash, some joint pain, red eyes. What's so wild here is how, normal these symptoms are. It's the kind of stuff most of us would just brush off, you know? And that's exactly the virus's trick. Its best disguise is looking like no big deal. And this is why we're talking about it. Because while the illness itself might be totally forgettable for most people, the potential consequences, they are anything but, especially for pregnant women and their babies. The stakes here, they are incredibly high.
So, to really get a handle on how we diagnose this tricky virus, we're going to have to put on our detective hats. Think of this as a medical detective story. Our mission is to find the right clues to solve the puzzling case of Zika.
And you know, every good detective story starts with the right question. With Zika, it really just boils down to two very simple things. Are you infected right now, at this very moment? Or were you infected sometime in the past? That's it. The answer to that simple question determines which tool, which test we need to use. Okay, so let's tackle our first line of inquiry. How do we figure out if you were infected right now? For this, we need a test that can catch the suspect, the virus itself, red-handed right there at the scene of the crime.
And that tool, our first piece of detective gear, is the PCR test. Think of it like a high-tech genetic scanner. It's not looking for clues the virus left behind. It's searching for the virus's actual genetic code, its RNA. If the PCR test finds that RNA, there's no question. It's proof positive of an active infection. Case closed.
Now, okay, where do we look for this genetic evidence? In your blood or in your urine? Well, this right here shows why the sample type is so critical. The virus's genetic material, that RNA, it disappears from the blood pretty fast after about a week, but it hangs around in urine for up to 3 weeks. That gives us a much wider window to catch it, and that's why urine is usually the better bet. So who needs this PCR test? Well, it's really for anyone who has symptoms within a couple of weeks of being in a Zika-prone area. It's also super important for pregnant women who think they might have been exposed. And it's for anyone who needs to be sure they don't have an active infection, say for family planning reasons. All right, on to our second investigation. What if the virus is already come and gone? What if the suspect has already fled the scene? In that case, we're not looking for the virus anymore. Now we're dusting for fingerprints, the evidence the virus left behind. And this is where a totally different tool comes in, the serology test. This is a blood test, but it's not looking for the virus. It's looking for the antibodies your body created to fight it. These antibodies are like your immune system's very own fingerprints, irrefutable proof that it's seen Zika before. Now, these antibody fingerprints, they tell a story over time. Think of it like this. IgM antibodies, they're like the first responders, the SWAT team that rushes to the scene. If we find those, it means the infection was pretty recent. Then, a little later, the IgG antibodies show up. They're the long-term memory guys. They stick around for years, a permanent record of a past infection. By seeing which type is in the blood, we can piece together the whole timeline. But, you know, just like any good detective story, there's a twist, a big one. With antibody testing, we can run into a major complication, a classic case of misidentity. So what's the catch here? Why isn't a positive antibody test always a slam-dunk closed case? Well, the answer is this mouthful of a term, serological cross-reactivity. But all it really means is that the fingerprints left by one virus can look so similar to another that they can actually fool the test. So your body's antibodies for a different virus might accidentally trigger a positive result for Zika. And here they are, the usual suspects. See, Zika belongs to this family of viruses called flaviviruses, and its relatives like dengue, yellow fever, and West Nile, they all look pretty similar to our immune system. So the antibodies your body made to fight off dengue years ago might get confused for Zika antibodies today. So here's the bottom line. A positive Zika antibody test, especially if you've ever been in places where viruses like dengue are common, could be a false alarm. The test might be picking up the fingerprints of a past dengue infection completely by mistake. Okay, we've looked at the evidence, we've uncovered the plot twists, so now let's put it all together. How do we choose the right clue to finally solve the case? This slide right here, this is basically our detective's cheat sheet. The PCR test looks for the virus's genetic code, its RNA, to answer the question, am I infected now? And you gotta use it pretty soon after exposure. The serology test looks for antibody fingerprints to answer, was I infected in the past? And it's best used a couple of weeks later. Two different tools for two very different questions. And let's not forget for a second why all this detective work is so vital. For a pregnant woman, an undetected infection can lead to devastating birth defects like microcephaly. For other adults, it's been linked to Guillain-Barré syndrome, a rare disorder where your own immune system attacks your nerves. So yeah, getting the right answer really, really matters. Ultimately, you are the key witness in your own case. Your travel history, when your symptoms started, any potential exposures you can think of, these are the essential clues. You've got to share all of that with your doctor so they can choose the right test and, just as importantly, interpret the results correctly. Let's just end with this thought. A test isn't going to change your travel history. It can't change where you've been. But the right diagnosis, that can change absolutely everything about your future. It empowers you to make informed health decisions, to plan for your family, and it gives you the clarity you need to move forward with confidence.